Good morning, everyone, and a very warm welcome to all of you who are joining us today. I'm Tanya from PAWS, and today I am honored to be your moderator for this webinar. So we are absolutely thrilled to bring you this webinar entitled Empowering South African Companion Animal Organizations as Rabies Centers of Excellence, or RCEs. That's something you'll hear a bit more about today. A groundbreaking initiative presented in collaboration by PAWS and the Global Alliance for Rabies Control, or GARC. So today really marks a significant step towards strengthening our collective efforts to combat rabies and enhance animal welfare across South Africa. We are here to introduce you to the concept of an RCE and to show you how your organization can play a pivotal role. So just before we dive in, just a few quick housekeeping notes. So this webinar is being recorded to enable us to share it with all of you, the attendees, and then also to other organizations that sadly could not attend the session this morning. If you experience any technical difficulties, we suggest that you leave the meeting and then just rejoin. You would have noticed we have activated the Q&A section or function for the session, and that is to ensure that we can track and reply to all your questions. So we really encourage you to use the function, add your questions in while you're listening to the various presentations, and then we will try our best to reply to all your questions with all the relevant information, but also please feel free to direct your specific questions to our speakers. You can do that in the chat, and then we will try to facilitate that during the Q&A session at the end of the webinar. And if you are joining the webinar perhaps from your mobile phone, please note that the Q&A function is not available, and that's as per Microsoft Teams regulations. So, hope everyone is ready. Let's get started. Rabies remains a devastating yet entirely preventable disease, and our shared mission is to eliminate rabies in South Africa. To kick us off this morning, I am honored to introduce our first speaker. He's the recipient of a Rabies Hero Award for his work in rabies education, as well as community outreach and engagement. Please welcome Kevin Leroux, Chairman of the South African Rabies Advisory Group and Project Manager for the KwaZulu-Natal Department of Agriculture in South Africa. Kevin, please provide us with an overview of rabies in South Africa.
Thank you, Tanya. I hope you can all hear me. To the organizers, thank you for this opportunity. Yeah, it's a great privilege to speak to especially welfare people. I have an incredibly high regard, and I believe that welfare is such a pivotal role, plays such a pivotal role in rabies in South Africa, because if there's a problem, where do you go? You go to a welfare group first. And so in terms of surveillance, it's absolutely essential to have welfare groups on board. They play a huge role in terms of vaccinations and have an incredible role to play in research, because they're at the coalface where we meet the relationship between humans and animals, and understanding the social aspects of rabies is so important. How people move and why they keep dogs. So welfare is just absolutely essential in the whole thing. Also, we've also noticed that if you're wanting to start a welfare group, start by vaccinating dogs. It's the law, so you have to vaccinate your dogs, and it's an excellent place to start, and you immediately see welfare issues. And so a welfare can actually grow around a rabies vaccination point, which is a unique relationship. So I just want to let you know what is happening in South Africa to get an overview. If we start way back, it's nothing new, rabies in South Africa. It was first recorded in 1892 in a case in Port Elizabeth, or Gqeberha as it's known now. And since then, I'm not going to go into the details, but in the 1940s and 60s, that a really aggressive sort of dog type rabies was introduced into South Africa, came down through Zimbabwe, through Mozambique, and it established itself as endemic cycles in 4 provinces, Limpopo province, Mpumalanga, KwaZulu-Natal, and Eastern Cape. And there is some history about the way in which and the direction in which it moved. Okay, next slide, please. And when it arrived in South Africa, it found a perfect environment for it to flourish. And a lot of those areas, if you think about rural Limpopo, Eastern Cape, KwaZulu-Natal, and Mpumalanga. They're vast rural areas where we have cultures, a dog-keeping culture. People love dogs. They keep lots of dogs. And there's also no restrictions on these animals. And it's also, at the same time, difficult to provide services for a lot of these vast rural areas. And so it's the perfect place for rabies to flourish. And that's just a picture from KwaZulu-Natal. Sorry, if you can just go back. And it is the perfect environment for rabies to flourish, and it spills over into cities, as we've seen in some of the big outbreaks. But for the most part, it is hosted in these rural areas. Next slide, please. Just to give you an idea of what's happening in South Africa geographically, so you can see the yellow circles are endemic dog rabies. That is also where humans die of rabies, because 99% of all human deaths occur from dog bites. And that has been the pattern for most of our history. But we also have other rabies in South Africa, which are related to other hosts. In the Northwest Province, we have a black-backed jackal cycle that flourishes up there. It spills over occasionally into dogs, but it's not the primary problem. In the Free State, we have a yellow mongoose cycle. In sort of Free State going to Eastern Cape, we have an aardwolf cycle, which is very interesting and sad, because these animals eat termites. They're not typically the carnivores that we think, but there's a cycle there. And then the bulk of the Northern Cape, Western Cape is bat-eared fox rabies, and it spills over into livestock and so on. And then, of course, we have this brand new cycle along our southern and western coast, which is the Cape fur seal. And unfortunately, we don't have time to really look at that, but it is an endemic disease in Cape fur seals, and it impacts people, with lots of people being attacked. But if we go back to the dog cycle, these are the places in South Africa that we have to focus on. There's a small dog cycle on the border of Lesotho, as the disease often spills over from Lesotho. But if in South Africa we wanted to stop the disease and stop humans dying, which is our goal for 2030, these are the places that we have to work in. And you'll see just by the by that Mpumalanga there is blank, because the disease has been completely controlled in that area. Next slide, please. So rabies, as I say, has been around for a long time, and it goes along at a relatively low level, around about between 20 and 40 cases a month in the country. And you can see that the human cases follow the animal cases. When there's an increase in dog rabies, there's an increase in human rabies, and that's been historically correct. But what this picture shows you is an epidemic, like that something has never been seen before. And that happened in Nelson Mandela Bay, Gqeberha, in 2021. And although I don't have the time to go into the details of this outbreak, what it shows us is that, and there was a corresponding outbreak in KwaZulu-Natal at the same time, when the disease is neglected, when dog vaccinations are neglected, and this was around COVID time, remember, that you have the potential for these explosions. And we're talking about 600 cases in one city in a year, which is staggering. And of course, with that comes the resultant deaths of humans. But what it also shows you, this map, is the ability for us to get on top of massive outbreaks. And the work that was done there by the state in collaboration with other welfare groups, I think the SPCA played an incredible role here. The Battersea group, they managed to get this disease under control, and it's actually gone from that city at the moment. And so there it just shows you this can be controlled, because a lot of people don't believe that the disease can actually be controlled. It can. Next slide, please. Oops, there's one graph missing here, but that's okay. Just to show you a typical pattern, if you look at the bottom right-hand graph, the little blue columns are the disease occurring in the different provinces. And you can see that typical pattern where KwaZulu-Natal just completely overshadows everybody else. We have a laboratory that's close by, very good awareness about the disease. So that is a typical pattern. And on the left-hand side, you can see what happened in the Eastern Cape. Suddenly that outbreak occurred. But we have 2 laboratories. We're establishing a third laboratory now in Queenstown. And the surveillance is pretty good in the country, but it depends largely on welfare for actually submitting those samples. In KZN, almost half samples come out of welfare groups. Next slide, please. This is the distribution at present for 2025. You can see it's focused around Durban. It's around the Eastern Cape is actually very, very, very low at the moment. So they've done some excellent work, but there's also been challenges with submitting samples. But otherwise, the patterns are the same, and the seal rabies continues as it is. The human cases occur in Eastern Cape, KZN, and Limpopo province. Next slide. I mentioned about the seal rabies. We have had, I believe it's 81 cases now in seals along the coast. It brings a completely new ball game to play here, as we believe the seals were infected by jackals, possibly up in Namibia, also along our coast, and it's now endemic. And again, welfare are playing a huge role in actually spotting cases, awareness, or creating awareness, and helping us actually understand the disease. But it's a dangerous disease, and a lot of people are being attacked, and it's required a huge amount of research and a big One Health effort to try and get all the different industries involved and understanding what the disease is. There's nothing much we can do about it at the moment, except tell the public. And we are working on some really cool research about possibilities of vaccination in the future, but that's another long story. Next slide. The important facts about rabies in South Africa. Dog rabies can be eliminated. That's a very, very important thing to understand. We have had examples in KwaZulu-Natal in 2014 after a project there. We reduced dog rabies by 93%, and we stopped all human deaths for 2 years. In Mpumalanga province, at present, there is no rabies, except the odd case in a mongoose, but that is quite separated from the dog rabies. And of course, the Eastern Cape example, stopping this disease in Nelson Mandela Bay is a monumental victory. And so what these do, and putting them together along with other examples in the Free State and so on, it shows very clearly that we can stop this, but we need people, we need vehicles, we need vaccine, and we need collaboration. It's a One Health disease. We have an excellent post-exposure system in South Africa compared to the rest of Africa. And really, people do get treated. We treat massive numbers of people. Every now and again, somebody falls through the cracks of a system that's imperfect, but we do have a good system. And many of the welfare people are the first to be exposed because they are the ones that catch the angry dogs. So again, respect to those. We have to make sure that they are vaccinated correctly, pre-exposure, to make sure that they are protected. Then education and awareness is a massive, massive thing. If people understand the disease, they will have their dogs vaccinated. They will make sure that they report any problem animals to the correct authorities, and they will make sure that they get treated. So whatever we do, it has to start with education and awareness. And again, welfare plays a massive role here. There's also far more to what is happening out there. The social economic factors in South Africa are changing the landscape of dog ownership. We have had pit bull revolutions whereby suddenly everybody's keeping pit bulls. We have a huge guard dog revolution that's happening at the moment because of safety and security. Everybody wants a bigger, badder dog. And what happens with that is that people start getting bitten. So again, the welfare are perfectly positioned to be able to understand those social changes. And also we need to adapt our education. It's not just about rabies. If you see that little child reading a book there, the booklet that he has is about how to look after your dog, how to treat your dog, etc., etc. So rabies is no longer just about vaccinating your dog. It's about the holistic view of what is important to the child. And we also forget how important this relationship is between owner and dog. It's such an amazing thing, especially for early childhood development. So the education is very, very important, but it needs to be adapted. A lot of education in South Africa is stale, it's old, and we need to adapt with the times. Therefore, I also say that welfare is an important place for research, where we understand why everybody's keeping bigger dogs. How do you actually keep a dog safely? Locking it up behind a fence is not simply the answer. There's so much more to it. You have to actually manage that artificial environment. So there's lots to do in terms of education. And then, of course, a One Health approach. And that's what we're here today also about, is everybody needs to be involved. The seal rabies is so fascinating because we are dealing with diamond divers, lobster divers, kayaking companies, snorkeling companies, along with all of the other groups that are involved with just tourism. So One Health is so important. People need to be treated, dogs need to be vaccinated, and along the line, there are so many different things involved, education, etc. So I hope that you enjoy today's webinar. I think that there's a lot to talk about. We are always here. This is a pet project of mine, but building this relationship is the most important thing that we could possibly do, because a well-adapted child with a happy dog means a happy, safe family and a community and a society where it's all linked together. So thank you very much, and have an amazing day.
Thank you so much, Kevin. That was really, really insightful and so nice to listen to. A lot of important information and points that you touched on. And just a note to you and everyone, we've added the missing chart into the chat so people can see it there. Let's move on. It is now my pleasure to introduce you to one of the leading animal welfare professionals in South Africa, fighting and advocating on legislative as well as ground level for a world where humans treat animals with respect, empathy, and understanding. Fiona Miles has been the director of animal welfare organization PAWS in South Africa since 2006. Fiona, please join us to talk about PAWS and the companion animal work done by the organization.
Thank you, Tanya, and thanks to everybody who's been able to join us today. And we hope that this will also go beyond and into the future. Yes, PAWS is the global animal welfare organization for animals under direct human influence. Our approach is that we, that animals that are suffering from, excuse me, sorry, I've got a little bit lost there. Please excuse me. We reveal suffering, rescue animals in need, and of course, protect them. We operate across the globe. We were founded in 1988 in Austria. And since then, we've developed across the globe to 15 countries, including South Africa, and operate 11 sanctuaries. We reveal inappropriate and life-threatening conditions for animals under direct human influence. We rescue animals in need worldwide and reduce and end the suffering of animals with continuing help in medical care. And we protect through providing safe homes for wildlife, such as big cats, bears, and orangutans and elephants rescued from non-species appropriate keeping conditions. As Tanya mentioned, our vision is a world where people treat animals with respect, empathy, and understanding. And it's really important that this message and this mission is transported. It's not something that we or any other organization can do alone. And so that's why we're here today, to collaborate with and work together with GARC, as well as the other organizations present here today. Next slide, please. Thank you. The way that we work is to operate, and especially what was mentioned earlier on, is that education is very, very important. So from an educational perspective, running campaigns that address various issues, various animal welfare issues, is really critical. And we work across farm, wild, and companion animals globally. So those campaigns, of course, are meant to educate. They're meant to reveal the issues, the animal welfare issues in these categories. They're also meant to, not only for the general public, but of course to various stakeholders, whether they are from industry or whether they are governments. But we really need to first understand what we're dealing with in order to be able to solve those issues and make sustainable improvements for animals. Under our farmed animals area, we run a number of campaigns. Live Kinder is a sort of a broad-based campaign where we really educate people and inform them of how small changes that we make on a daily basis can actually make an impact. We all think that, you know, what's the use of trying, but actually educating people, showing that we can do different things, actually goes a long way. And part of the Live Kind, or underneath it, is Wear It Kind, where of course we look at sustainable fashion and what we consume. Under the wild animals, Break the Vicious Cycle is an important campaign to us. It's been a long-term campaign. It covers the issues related to big cats in captivity globally, and specifically in South Africa, where South Africa is intensively breeding big cats for commercial purposes. And around that, of course, again, to the consumer, how we can travel kind and not participate in various practices as consumers that actually have a negative effect on animals. In terms of the companion animals, which is more what we're here to speak about today, the focus is, of course, on humane treatment and population management of stray dogs and cats. As was mentioned earlier on, the responsible pet ownership and the education that goes alongside the incredible work that is done by so many organizations on the ground is really, really important. Oftentimes, that component is sometimes neglected, and it's really important that we ensure that work being done on the ground is sustained through education and through change in human behavior. Another project and campaign that we work on is, of course, ending the dog and cat meat trade in Southeast Asia. This is a very cruel trade that, amongst others, undermines rabies elimination efforts in targeted countries. And of course, this is also seen on the African continent. Next slide, please. Some of the impact that we've been able to have thus far is in terms of dog and cat population management. Our approach has always been, as we have a relatively small presence, is to collaborate with partners. And this is what we're here to do today, is to really create those platforms for dialogue, for information sharing, and so that we can support some of the efforts that were mentioned earlier on by Dr. Leroux as well, where the needs are. And so we've supported sterilizations and overall care of companion animals in specifically under-resourced communities, supporting improvement of standards in South Africa through the Shelter Adoption Academy. This is a free e-learning course for shelter staff and volunteers to improve adoption rates. Advocacy is incredibly important, and we've really been working together with governments for better implementation and funding of humane companion animal population management, education initiatives, and overall animal care, including the elimination of preventable diseases such as rabies. I think there needs to be a huge partnership so that we work together to work towards that goal for 2030. Vaccination campaigns. So, of course, we support our partners in administration of rabies vaccines and other care for dogs and cats in the communities, and public awareness campaigns and community outreach programs to promote responsible pet ownership. Next slide, please. Our position on rabies elimination is that PAWS supports the World Health Organization's goal to achieve zero human rabies deaths by 2030. And we've joined forces with the Global Alliance for Rabies Control to improve the elimination efforts for South African organizations. That's why we're here today, is to provide this platform and to really see how we can bolster and boost the incredible initiatives that are ongoing, and that we can bring people together, convene people together, and join forces to make a much bigger impact and a sustainable impact into the future. And of course, better and coordinated efforts and collaboration is really important, so that overall the welfare of animals can be improved. Next slide, please. Thank you. I suppose just in conclusion, that was a very short overview of PAWS. We are here to really support these efforts, to work together and walk side by side, not only with the Global Alliance for Rabies Control, but with everybody present here, so that we can create a better future for animal welfare, create a better future for South Africans, and take on the One Health approach. We would like to support, and I was listening to some of the opportunities that can actually come out of these partnerships, and we're looking forward to working together with all of you and to ensuring a better world for South Africa and for animal welfare worldwide. Thanks for your attention.
Thank you so much, Fiona. Carenza Vlasto is the Community and Outreach Director at the Global Alliance for Rabies Control, and she's been instrumental in expanding the organization's global reach. Carenza has dedicated her career to animal welfare and humane education, advocating for sustainable, community-driven solutions to really improve the lives of not only animals, but also people. Welcome, Carenza.
Thank you, Tanya. How is everyone today? I hope you're well. Thank you for having us here. I will just give a very short overview of GARC, what we do and how we work. And then at the end, there will be a slide if anyone needs more information to get in touch with us. So next slide, please. So GARC was established in 2006, and our vision is a world free from dog rabies. So our work does focus on dog-mediated rabies, as this for us is the primary source of suffering, dogs and for people, of course, especially in Asia and Africa. Next slide, please. So the way in which we work is actually building capacity from the individual's level and community right up to the level of national governments, for example. Next slide, please. And how we do that is by supporting the stakeholders with our GARC data platform. And I will go into more detail on these topics as we move forward. We offer online educational courses, so it's known as the GARC education platform, as well as downloadable resources for people to use, and of course, expert guidance and continuous support. Next slide, please. So the GARC data tools, they can be found on the data platform. These are some visuals, so you can see what the actual outputs look like from organizations that collect data. So the GARC data platform basically enables users to capture, analyze, and then in real time visualize rabies data across all aspects of the disease. At the moment, it's used by about, I think it's 35 countries and more than 80 governments and organizations worldwide. It distinguishes us from other organizations because we do believe it is the most comprehensive rabies data system available and very advanced as a platform. Next slide, please. The best thing with these tools on the platform is that they are free. Also, the data belongs to the organization, to you. We can only use it or have access to it, let's say, if we have written consent from the organization. It is tailored to your needs, and also, of course, the training and any support we offer you is also free. And these tools are available online and offline. I'll leave that slide up just, a little bit for everyone to see the actual tools and how they may connect to your work. So vaccinations, bite cases, education initiative trackers as well, rabies treatment trackers. I think now we can move on to the next slide. Thank you. The GARC education platform, as mentioned, hosts a lot of online courses, with more being added as we speak. It is free. It is online, but you can also download a PDF of the content to study in your own time, self-paced, and all the courses are certified. The GARC education platform actually gives people the chance to learn the basics and build very useful skills to help their work against rabies. So there are courses, as you will see here as well, from the ones listed for health workers, vets, basically anyone working in the community. You can take it a step further and become a certified dog health champion. And once you finish the courses, you will know and understand a bit more of how to follow proven methods to stop rabies and improve animal welfare. We also have extra materials that help you teach others in your community, stop common myths, and share accurate science-based information. Next one, please. And then GARC also offers continuous expert guidance to organizations and governments, ensuring that it is relevant to the context and follows effective rabies elimination strategies. So organizations can benefit from hands-on support in design and implementation locally. And the Rabies Centers of Excellence program in endemic regions reinforces long-term capacity building as well as GARC structured support. We engage governments through expert-led workshops and planning tools like the stepwise approach towards rabies elimination, or SARE, as you may know it. And we help them to work strategically and collaboratively, as was previously mentioned under One Health, towards national rabies elimination goals. Next slide, please. So some of the things that are also coming up now, World Rabies Day on the 28th of September. We actually have the global map, for those of you who are not familiar with it, where everyone can register their events that are coming up for the day. There are also plenty of free resources in connection to World Rabies Day, but also generally general rabies resources. With regards to World Rabies Day, we have an event planning manual to help you work through what kind of event you might want to hold, how big, how small, how to organize it, what things to think of, and so on. We also have a social media toolkit, which essentially provides you with all the social media posts for the month of September, leading up to World Rabies Day, with the hashtags, the images, everything ready to just copy paste over to your platforms. And then last but not least, we also have World Rabies Day Awards in collaboration with Boehringer Ingelheim. You can nominate yourself or someone else that you know working against rabies. These are for individuals. There are 4 different categories for veterinary clinics, education champions, animal welfare champions, and vaccination champions. And on World Rabies Day, we actually announce those who have been shortlisted. And then there is a public vote open until end of October. On One Health Day in November, the awardees are announced. Each awardee receives $1,500 in cash towards their work, and then also in-kind support worth another $1,500 for their programs in terms of the GARC data tools. Again, if you have any further questions about these, please do not hesitate to drop us an email or reach out via our social media. Next slide, please. A big thank you. And the last slide is our contact information if you need to get in touch. Next slide, please. Oh, okay. Thank you.
Thank you very much, Corinza. That was some great information. I love the sound of all the free and useful resources. But let's move on to our next speaker. If you need to design, implement, and manage technology-driven solutions that tackle critical challenges, then Dr. André Kutzer is your man. His work focuses on empowering stakeholders and driving meaningful change in the fight against rabies. It's now my pleasure to welcome Dr. André Kutzer from GARC. Thank you.
Thank you so much, Tanya, and thank you everybody for welcoming me to today's webinar. It really is a pleasure for me to be able to just take a few minutes to provide an overview of the Rabies Centers of Excellence, the general thinking behind it, but also why it's important for organizations to strive towards this recognition and the benefits that it provides. So next slide, please. So although we're talking about a global situation, I think from what Kevin showed us this morning, South Africa is no different in that despite being a disease that's been around, anecdotal evidence suggests a disease like rabies 3,500 years before BC. We've had vaccines since the 1800s. Rabies still affects up to 150 countries around the world. South Africa is no different. And there is this element of global strategic plan. And this is a strategy that is reliant on governments setting their rabies elimination objectives, taking ownership of their rabies control programs through the implementation thereof. But we tend to forget that just as we have with small animal welfare groups, governments also face programmatic challenges. They also have limited resources and funding. They also have a lack of trained personnel. So regardless of the scale, they face these challenges that smaller groups face as well. The next slide, please. And there is a solution, and I'm so glad that Kevin alluded to this as well this morning, and that is the fact that we might have at a national level programmatic challenges. There is a solution, and that is non-governmental stakeholders working at the community level and partnering with GARC to support and further their own efforts. Next slide, please. Just as an overview, Corinza mentioned this morning, GARC's main approach is to really empower and strengthen the capacity of those people already on the ground. And our specific focus is to support and empower groups that can further the national objectives of rabies elimination. And this includes government agencies, veterinary and animal health professionals, community leaders and educators, but most specifically, animal welfare groups working at the front line that are there to support their communities. Next slide, please. And we really do this by providing the support we know is much needed. And I'll go into these elements, but our main focus is on expanding the knowledge of staff and volunteers, being there to guide groups, provide them with tools and resources that really further their efforts. But to us, it's also really important to highlight who these organizations are, to promote the work that they are doing, because it might be a small drop in the ocean, but they make a lasting impact on the communities that they serve, and they deserve that recognition. So next slide, please. The difference, though, in how we support these organizations is this isn't haphazard. This is done through an established, structured program, and we use a phased approach that allows us to integrate in a step-by-step manner the tools and resources that we have to the benefit of the organizations. So next slide, please. So we run 3 phases. And the first is, and I'll go into a bit more detail into each of them, but the first is to build the individual capacity within each organization. From there, we progress to building the capacity of the organization itself. And the third element is providing that ongoing support and opportunities to the organizations that partner with us. So as I mentioned, I'll go into them a little bit more detail. So next slide, please. I'm a firm believer that it's wonderful to provide support to an organization. It's more important to ensure that the people working within that organization have the skills and knowledge that they need to do the work to the best of their ability. And that's why our support starts at that individual level. So next slide, please. And we face a problem at the person level, at each person, and that is simply insufficient knowledge and training. Whether we're talking about animal health professionals, from animal health technicians to veterinarians that get multiple years of training, rabies is but a component of a much larger curriculum. And we tend to think, well, it's an animal health professional, they have the training. That's not necessarily the case when it comes to the granular detail of rabies. If we remove ourselves from the animal health professionals and we look at welfare groups, what we typically see is a trend where these groups rely on well-meaning, dedicated, animal-loving volunteers. These are not people that have been trained or have been given all of the relevant knowledge. And we know having that knowledge is extremely important. Anybody that is facing their community needs to know, what is rabies? How do I communicate this information? How do we teach people about bite prevention? But also, how do we mobilize communities? How do we promote responsible dog ownership and improved animal welfare? These elements are largely missing or reliant on fragmented knowledge. So next slide, please. But we do have a solution, and Karenza mentioned this when talking about the support of the tools that GARC provides, and that's the GARC education platform. So next slide, please. Really, what it comes down to is these free-to-use, self-paced educational courses are there to provide anybody with the knowledge that they need to be the best possible rabies champion in their community. And these courses are reliant on people spending a bit of time learning knowledge that's based on the African and Asian setting. So these courses do not provide pie in the sky ideas and information. They provide information that's relevant to the people working at community level. And I'm highlighting just 4 of the courses. And unfortunately, I've lost the animation. But just to give you an idea, every course provides a certificate of achievement, of completion. But by completing the Rabies Educator Certificate, our foundational course that covers everything about rabies, how it is spread, which species are involved, how do we prevent bites, and there's a whole module on how do we communicate effectively with people. If you complete that course and the community coordinator for certificate, which allows people to become a rabies champion in their community, you automatically get a 3rd recognition, a 3rd certificate, which says you are now recognized as a bronze level dog health champion. If you continue with these free courses and do the dog welfare certificate, an amazing course aimed at improving dog welfare with knowledge and advice based on resource limited communities. And if you complete the animal handling and vaccination certificate, which deals with how to humanely handle and vaccinate animals, but also how to evaluate dog behavior for safe vaccination practices, you get a 2nd follow-up certificate, and that is silver level or silver tier dog health champion. Next slide, please. And this isn't just a recognition. This is recognition given to people to say, you are now forming part of a global workforce that is working towards rabies elimination. By becoming a dog health champion, you get recognized as a community stakeholder that's there to promote humane dog health and welfare. Next slide, please. And as I mentioned, all of these tools and resources aren't pie in the sky. They rely on established tools. And just to give you an idea, to date, there's more than 20,000 rabies educators around the world. There's more than 1,200 bronze dog health champions as of the end of last month. But these are really just numbers. They're metrics. It doesn't mean much if it's not valuable to the people. So I'm not going to spend too much time, but next slide, please. We asked people from all around the world, what did these courses do for you? What does it mean now that you are a dog health champion? And we see various things. And this is from almost that expression of the truth is from the person who gives it, right? And what we see is people saying that these courses, this knowledge has raised their confidence. It has helped them to feel more capable at addressing issues and challenges. And it's opened the door for them. It's given them this element of continued professional development. Next slide, please. That's one element. That's the staff now having the knowledge and skills to be that source of information that their community needs. But the reality is, people still work within these organizations, and there's support that can be provided there as well. So next slide, please. As I mentioned at the start of the talk, governments, just like any other program, have limitations. And the reality is, no governmental program can reach every single community. It's logistically not possible. And what we see, and I think I'm speaking to the right group here, is that these gaps left by governmental reach are what's quite often filled by our non-governmental organizations, our welfare groups. These groups, whether we like it or not, are there because there's communities that need them, and there's nobody else that's able to provide that support. And we see our animal welfare groups supporting activities where the government cannot reach, but also working alongside the government, offering additional services like dog population management, or working in collaboration with the government to help reach communities that would not benefit otherwise. Next slide, please. But just like any other program, we know that welfare groups do have limitations. There are obstacles. I've mentioned one already, that quite often they rely on volunteers. Good meaning, well-natured people doesn't necessarily have the relevant training and knowledge. These groups typically rely on outdated data capturing methods, paper-based records that never gets used for anything. It's not used for promotion. It's not used for reporting. And then there is the element of, and I was so glad when Kevin mentioned this, on educational resources. What we typically see is groups get a donation of some sort of booklet or flyer, and then they distribute it. It doesn't mean it's in the correct language. It doesn't mean it's cosmetically or visually appropriate or relatable, but that's what we have, so we have to use it. And then lastly, because of all of these things, of perpetually trying to fit a square shape through a circular hole, we see that welfare groups have limited time and capacity for donor engagement and raising funds. All your effort is going towards serving the communities, which means quite often there's limited ability to find that next donor, that next piece of finances that can help you go a step further. So next slide, please. And what we want to do is to offer solutions that help groups overcome these obstacles. If I take the most basic example, the personnel, I've already alluded to that with the Rabies Educator Certificate, the Dog Health Champion, all of those. What we want to do is build and expand the skills and knowledge through the education platform and ensure that these groups working have trained personnel that have the relevant, scientifically backed knowledge that they need to empower their communities. Next slide, please. But we also want to help groups with data collection. So Karenza mentioned the data platform. It's a free-to-use app that allows you to collect your vaccination, sterilization, education data. But what this does, it doesn't just collect the data, it then sends it to a website where you can log on in real time and see maps and graphs and pivot tables where you have vaccinated, how many animals you've reached. I'm sure you could do that with paper-based records, but do you want to spend 3-4 hours every evening sitting there doing these types of things? Because I urge any group to start using data technology. There's a big element of donor engagement that's improved by being able to show people, show donors where you have worked, what is your reach, what is the impact that you are making. I almost want to say the era of photos on social media is not going to do that for you anymore. Having a Facebook post that says we have vaccinated 200 dogs, people scroll past that because it's now just turning into a number. But by using things like the GARC data platform, you can start sharing maps and graphs that show exactly where are these dogs? How far do you drive to reach these communities? Why is it important for you to get that additional funding to go on to that next community? Next slide, please. On the educational outreaches, for those of you who don't know, GARC has a extensive resource bank of educational resources available in several languages aimed at different target audiences, different themes. All of these resources are free to use, but we also work with organizations to include other translations, to work towards more relatable imagery in these resources so that when you have these outreaches, you have resources that are truly applicable to the community that you are serving. Next slide, please. And what we want for animal welfare groups is to really embrace the tools and resources that I've mentioned here. Because to us, this is an element of saying this group is dedicated to community engagement. They dedicated to improving themselves and their staff. And what we find is groups that embrace these tools and resources become recognized as a GARC Rabies Center of Excellence. And to put it into perspective, it is saying that of an entire list of welfare groups working within any country or any part of the country, which are the groups that have stood out, are noteworthy stakeholders. They're willing to better themselves. They're willing to make use of technology. They're willing to be the best possible organization that they can be. That is our Rabies Centers of Excellence. Next slide, please. So the question is obviously then, what's the benefit? Why should we become a Rabies Center of Excellence? Because you'll notice up to now, I haven't mentioned any financial requirements, and that's because there are none. Obviously, by becoming a Rabies Center of Excellence, you get access to the free-to-use GARC data platform, all its data collection tools, its visualization. You get access to the free educational resources. But you also form part of a larger community of like-minded organizations. We are working to establish a network across the country. And there's benefits to that I'll come to next. As a South African Center of Excellence, when you become recognized, you also get access to immediate small once-off cash donation to help you with your next vaccination drive. And you also get access to ongoing webinars, online workshops, training opportunities to further your own organizational capacity. Next slide, please. So once again, that might just sound like I'm blowing my own horn here. So I've provided you with some feedback from centers of excellence elsewhere in the country. And these are from groups. This isn't from me. And what we see is we see groups saying this recognition have given them credibility. It's given them the ability to suddenly start engaging with local government a little bit better. Because now they're not just some group, they're a rabies center of excellence. We see groups talking about the benefit of being able to connect within this network, sharing knowledge and innovative solutions. And we see groups providing direct evidence of the tools and resources, saying it's helped them improve their staff. It's helped them improve the ability that they work. And I cannot tell you how many people we see with their CVs now having that they are dog health champions. It's something that people are actually proud of, and it's going on a CV. It's something that should be noted as a professional element. So next slide, please. And once again, this is not a soon-to-become program. To date, we have 23 centers of excellence around the world. So as an organization, our primary focus is on South Africa, Kenya, Sri Lanka, and Nepal. So you'll notice that there are big gaps on the map. But what we're starting to see now is more and more countries that are not our target countries. We have groups approaching us saying, well, we want to be a center of excellence. We've heard about this program. And we now have centers of excellence in India, as far as Ecuador and Latin America, in Ghana, because these groups have now become, it's almost that sense of envy. They also want to become a center of excellence. Next slide, please. But in South Africa, we have a network right now of 9 rabies centers of excellence. We know there's far more animal welfare groups in this country that would benefit from this support that comes at no financial commitment, but only to the benefit of the organization. And that is where we want to work with all of you as well, is to say, how can we support your efforts? So next slide, please. Because it's not just about those immediate benefits. GARC believes in building a lasting relationship with all of the groups we work with. And that is our ongoing organizational support. So next slide, please. And that comes in the form of almost 3 tiers. As Karenza mentioned, and I alluded to as well, we are there for any of our centers of excellence, providing assistance, providing guidance, providing advice on how something could be perhaps improved. As an organization, we have staff that are academics. We have staff that have worked in the welfare sector for many years. We have the knowledge. Our centers of excellence and their staff also benefit from ongoing international promotion of the work that they do. We don't just recognize them as centers of excellence and then disappear. We have various articles spotlighting who are these groups, what are they doing, what's the challenges that they face. And I invite you to have a look at, sign up to the GARC newsletter, have a look at our website. We've got a series called Excellence in Action. These are our centers of excellence. We have chats of champions. This is talking to centers of excellence, to dog health champions. And it's about promotion of their work. But there's one last element for South Africa, and that is additional funding support aimed at collaborative outreaches. And I just want to quickly touch on that. I am aware of time. So next slide, please. Within South Africa, we understand we might have various centers of excellence. They still work with limited resources, so we can help promote them. You'll notice that this structure isn't a funding structure that pays the bills for welfare groups. It's a program aimed at allowing groups to be the best possible organization for sustainability, be able to engage donors better, to be able to sell the work that they do a little bit better. But we also understand that as more centers of excellence come up, there's an opportunity for collaboration in vaccination campaign. And it all comes from that strength in numbers. And this is one extra benefit to centers of excellence in South Africa, is that we provide an element grant-based funding for collaborative outreaches. So next slide, please. Essentially, the grant is available to 2 or more centers of excellence. It relies on an application for a collaborative outreach. We want to see groups working together. The more centers of excellence work together, the bigger the grant is. And this grant provides funding to purchase high quality vaccine, funding to support the vaccination campaign implementation cost, but also funding to print and distribute education and sensitization material. Once again, the idea is not to support one organization financially. It's about building this collaboration amongst groups, because we don't want groups to sit and work in silos. The objective is the benefit of the community and its dogs. So next slide, please. Just to give you an idea, the first grant was issued late in 2024. 2 centers of excellence in South Africa applied. They were awarded the grant, which was 2,000 dogs could be vaccinated from this. Now, we might say in the bigger scheme of things, 2,000 dogs really isn't that much. At a national scale, it's not. But at a community level, it 100% is. Because this grant allowed these groups to work in their existing communities, but also reach new communities. Communities that without this grant would have dogs that would not have benefited from any primary health care or vaccination. So 2,000 dogs benefited. And to me, that's more important to what is the contribution towards the national rabies elimination efforts. Next slide, please. So the whole objective of today was to give you an overview of the Rabies Centers of Excellence, what it is, how it works, what's the benefit, and really say to you, why wait? Why wait? Why not become our next Centers of Excellence and benefit from all of these things? Next slide, please. So I'll end it there for now. Thank you so much for your time. Thank you, Tanya. I'll hand back over to you.
Thank you very much, Dr. Kutzer. All I can say is, where do I sign up? Because it sounds brilliant. With that in mind, and with all of that amazing information, we're going to hear now from someone who is part of an RCE. Hoedspruit Animal Outreach, or HALO, is a small NGO with a really big dream: to eliminate rabies in the Limpopo province of South Africa. Yvette Hess is here this morning to tell us more about their hard work in making this dream a reality, and how signing up as an RCE, as we've heard now, supported this dream. Over to you, Yvette.
Thank you, Tanya. HALO is...
Sorry, Yvette, I think you're a bit soft. I think I can't hear you. I'm not sure about everyone else.
Volume is very low.
Yeah.
Better now?
No, it's still a bit soft.
Better now?
We're just seeing if we can maybe adjust something or advise you on this side.
Go to audio.
If you go to audio settings, Yvette.
Issue yesterday. Hear me now?
No, very, very faintly. If you go to your audio settings, see what I can do here. Audio settings. Speakers, it's all the way up. Yeah. More. So, so Yvette, if you click on more and then look for audio settings, and then you can up your speaker. Sorry, can't hear you, Yvette. Do you perhaps have headphones that you could put on and then we can see if that works? No? Sorry to everyone. We'll just see what we can do. Just give us a minute or two, please. No, still soft.
If I speak into the microphone, can you hear me better?
It's still very, very soft. Mhm. Yvette, can you try and adjust your settings on your toolbar on your starter bar? If you right-hand click on it and see if you can get to sound settings there. There should be a volume bar that you could up.
Yeah, it's on maximum.
Oh.
So it's just.
Hmm? Is it on maximum? Oh.
Showing
Then it's definitely the Teams setting that you need to up. So if you see at the top, there should be a chat, Q&A, people, the reactions, and then there's a more option.
Yeah, I set that on maximum.
Yeah, and if you click on that and you go to the audio settings, then there should be a little volume speaker that you can put all the way up. So there's a speaker setting at the top, and then the second setting is your microphone. So if you click the last one to see that it's up until the fullest, and then also the
I wish I can show you.
yeah, no, maybe we can try if you bring your laptop way close to your face and maybe put off the camera, then we can try and see if we can hear you.
Is this better? Can you hear
We
me
can.
better?
It's a little bit better.
All right, I'll try. Is this better?
We can almost not hear, but we can try. I think there's nothing else, and I think we need to just try and continue.
I'm so sorry about the.
No, no worries. Let's see what we can do. Over to you, Yvette.
I'm trying to speak into the microphone. Yeah, so I hope I'll try and speak very loud, so maybe you can hear me better. Is that better? So Hootspot was established in 2016 after a devastating outbreak of rabies in 2015, where an entire pack of wild dogs was eliminated. We are surrounded. It is based in one of the of Mpumalanga. We're surrounded by private game reserve direct risk of the rabies, not only affecting people, wildlife surrounding Hoedspruit. Since 2016, we started with one community. Now we're currently in underprivileged, where we focus on the pillars of vaccination, sterilization, education. Yeah, we currently vaccinate about 3,500 dogs. But from the 1st of August, we're going to be vaccinating 1,000 dogs a month, thanks to that has our sterilization program currently is expanded, where we will be able to sterilize. Sterilization is managed. We got a lot of challenges as Halo work with. Obviously, there's still a lot of outbreaks, parvo and distemper. We've had rabies cases in affecting also casualty, and haven't been able to depend on governments as Halo try to fill the gap. Also have any other NGO challenges, making more monetary challenges where we struggle to get bills. The organizational challenges, thanks to now don't have to our paper reporting, but can rely on the quality our community where we don't have signal, still have a professional report. And on the personnel side of things, the education, upskilling our volunteers on rabies. One of the last challenges that on this slide is our resistance to change in behavior and vaccination. There's unfortunately a myth that a lot of people believe that dogs get lazy, get hunting, members still hunt, unfortunately. Is with challenges that is. Next slide, please. In 2024, we were recognized as a Halo Rabies Center of Excellence, giving us access to the latest info rabies elimination. We've had proper training, we've used the educational system. Our volunteers have completed online education, are available, access to funds, sending our rabies vaccination programs, and all. If Halo is one of our communities where the kids are being signed up as Halo heroes to go training that's provided by BARC, where they get the certificates to be rabies educators. Very popular. Yeah, last year we teamed up with ARC, an NGO operating about 80 kilometers away from us. They have similar methods and ethics as Halo, and together we work together, grants, Andre earlier mentioned, and now we've successfully that project, and we are keen to later this year. The collaboration not only helped us in vaccinating the 1,000 dogs vaccination, but also given us a lot of insight in each other's NGOs, together learning from each other on how to in line with our mission. Elimination of rabies is one of we strongly feel that through dedication and hard work our part aim to expand our reach next years, adding on more communities, more dogs, rabies, and thus building a rabies-free. Our stationary outreaches are only effective to a point, so we are going to cover the area with more outreaches, which is expensive and more labor intensive, but still we have to do it, and we'll try to find the fund that people to go. That concludes my talk. I'm so sorry about the technical things. I hope none of that nonetheless you heard what I was saying, and thank you.
Thank you very much, Yvette. Unfortunately, we couldn't hear everything, but at least your slides were great and we could read, and there were all those lovely images. So yes. And if anyone has any questions for Yvette, please kindly reach out to her. So now, very important to talk about the way forward and how all of you listening can become recognized as an RCE. We welcome back Dr. Andre Kutzer.
Thank you so much, Tanya, and thank you so much, Yvette. I think it's good hearing from a recipient of the Center of Excellence recognition as well, and hopefully that's stimulated some people to want to know more about the way forward. So next slide, please. So we've really tried to simplify this process for everybody. So I believe that the link on this page will be shared after the webinar. We'll get confirmation of that afterwards. But essentially, this link will take you to an online form on the 4PAWS website, which simply asks you to register your interest in becoming a Rabies Center of Excellence. It's a way for us to keep track of who's interested so that we can follow up and provide that necessary guidance as and when needed. But once you've completed that online form, you'll receive information on the next steps as well, but I've just highlighted them in this presentation deck. So once you've completed that online form, there's 3 additional steps to take. So next slide, please. The first is, and all of these pages, there are links in the form you get once you've completed the information sheet on the 4PAWS website. So don't worry about how do I get to these pages. I want to just focus on what needs to be done. The first step is to fill in a quick online form on the End Rabies Now website. The End Rabies Now website is the campaign website for the Centers of Excellence. It's not some different organization. It's GOG's campaign website. And all that this pledge does, it takes you about 5 minutes to fill in, is it creates a digital profile for your organization on the GOG website so that we can keep track of your progress towards becoming a Center of Excellence. So this is not a financial commitment. It's not a financial pledge. It's essentially just registering your organization on the Center of Excellence platform. Next slide, please. Once that is done, have at least 3 members of your team become bronze level dog health champions by completing the Rabies Educator Certificate and the Community Coordinator for Rabies Certificate. At least 3 people, it can be more. Once you have done that, you've submitted your End Rabies Now pledge, you have your dog health champions ready, you can progress on to step 4. So next slide, please. And that's all that you have to do. Once you've completed the first 2 steps is contact GARC. The email address is on the screen. It's been shared in chat as well. And notify GARC that you want to start using the GARC data platform. Once we have the email from you, we will arrange a one-on-one virtual demonstration, show you how it works, what it can do, how we can set it up for your organization, and then discuss the way forward with how to start using the data platform. Next slide, please. And that is it. So just to summarize, step 1, complete the online form. I believe the link will be shared after the webinar. It's on the 4PAWS website. Once you've done that, fill in the online form at the End Rabies Now website. Have at least 3 members of your team become dog health champions, and contact GARC to start using the GARC data platform. Typically, this process depends on how long it takes you to get your staff member upskilled, can mean Rabies Center of Excellence recognition can happen within 4 to 6 weeks, if not sooner. So this isn't a month-long process. We're not trying to make this so difficult that it's impossible to achieve. Our objective is to see groups benefiting from this. So next slide, please. So just once again, there is the link with the QR code to the 4PAWS website where you register your interest. This is just so we know who we can follow up with, who we can engage with and support to see that we grow this network of centers of excellence and have more groups benefiting from it. So next slide, please. So one last time from my side, thank you so much. Thank you for your attention. Thank you for taking time out to join this webinar. Tanya, I hand over back to you. Thank you so much.
Thank you so much, Dr. Kutzer. So now we move on to our Q&A session. So we ask that all our speakers turn on their cameras and prepare themselves for some questions. So we have received some questions in the Q&A chat during the course of this morning already. Our team have already answered, but please feel free to add any more questions there. And seeing as we've just spoken about it, there was a question which I also found quite interesting. What if an organization only has 2 staff members, and you mentioned, Dr. Kutzer, that you need 3 to become dog health champions to become an RCE. So how can small organizations potentially work around this?
100%. So what we do in those instances, we suggest if you have regular volunteers that accompany you on outreaches, whether that's just to educate people, they don't have to be hands-on with the activities, include them. They don't have to be permanent staff of your organizations. It could be seen as at least 3 members of your team. Include a volunteer, include the person who runs the admin for the group. Nobody is impervious to improved knowledge and more information about rabies and improved animal welfare. So that would be the recommendation in that instance.
Brilliant, brilliant, brilliant. And yes, it makes a lot of sense. So I'm just checking. It seems like everything was very clear. I mean, there was so much information shared that it seems like everything has been clear to our attendees, which is great. Does any of our speakers have any last words before we close out for the day?
Yes. Tanya, I actually have a question to Kevin. Obviously, we have welfare groups sitting in the Western Cape where we know dog-transmitted rabies isn't endemic. So Kevin, in your experience, considering the Nelson Mandela Bay situation, why is it important for welfare groups that are sitting in what's currently non-endemic provinces for dog rabies still maintaining these activities and pursuing this recognition, this upskilling? Thanks.
A tough question. So the one of the things that maybe I didn't make clear is that rabies can pitch up anywhere at any time. That is a fact. So whether it be the dog cycle or it be a wildlife cycle, it can move as fast as somebody putting a puppy into a car, and that's a regular occurrence. So it doesn't matter. The whole country is important, and wherever you go and there are animals, we need to have eyes on the ground. So they're going to be early detection. That's probably the most important. Without the SPCA, for example, in this area of ours, we're hopeless. These guys see more dogs than anybody. So welfare organizations are always the first point of call. So that's in terms of surveillance. They also normally have a connection already to the communities. So we can work with them to provide, to work together towards something. The other thing is that I believe as we go into the future, more and more welfare issues are going to need to be dealt with. We need the information to be able to inform us what is happening out there, and welfare are at the coalface. Very simply, veterinary services is often just a reactive organization that works with control diseases and major disease outbreaks, but we're not always connected to the dog. We run past with the needle and syringe. And, the future is that we have happy, healthy pets that are well adjusted, that are integrated into families, that live a long time, not this rapid turnover. So, and the education and understanding those pets is so important. So welfare is, I believe, not using its potential as it should do to gain information, do research, understand what's needed out there. I think that we together, because often we have the research side, the academic side, you guys, if we work together to use that data so that when a problem does arise, we can actually preempt it. And it's constantly changing. The environment is changing. So we need you guys as much as you need us in some circumstances. And it's all about relationships. If you have a good relationship with the welfare people, you can achieve anything, really. I've seen that over 36 years here in KZN. My friends are the ones I phone straight away from welfare, and I know exactly what's happening and we can get things done. So it's something that has to be worked on. It's a one health system, but we really have to actually work on it so that we can work together and keep each other going. We need each other. And thanks to GARC, this is an amazing initiative.
Thanks, Kevin. Thanks, Tanya.
Thank you so much. That was, really insightful as well. I see we have another question that popped up. So how will vaccine delivery be supported? I guess that is either Corinza or Dr. Andre.
So in this instance, it's one of those things we firmly believe we don't have to reinvent the wheel. Organizations already have suppliers that they have working relationships with that means that they are legally allowed to purchase vaccine, they're legally allowed to use the vaccine. And in those instances, for example, like the campaign that Yvette mentioned, GARC simply provided the funding for them to purchase the vaccine through their established channels. It's rather that than trying to fly in vaccine at much more expensive costs. It's about working with the structures that are already established on ground level. And there are various commercial suppliers of high quality vaccine already available in South Africa. The key element here is when we provide the financial support, it is towards high quality vaccine, not buying the cheapest possible vaccine to the benefit of 5,000 dogs, but buying a vaccine that we know if that dog is vaccinated, it is protected against the disease as it would be under any other circumstances. Kevin?
Yeah, if I may just say, in many places with us, we actually supply vaccine for free to welfare organizations. which may take some financial burden off another aspect of getting it into the community. And then, you know, you also, I'm not trying to hijack it, but if you're planning on vaccinating 100 dogs, but you can, and you have a good relationship with the state veterinary people, and they provide you with an extra 3 people, you could do 1,000 dogs. So, and very often welfare groups that are initiating something often catalyzes a response from the state, and they will join. I don't know if Andre's probably seen that as well. So welfare can be a very important aspect to actually get things going. And that relationship can double your effect.
Thanks, Kevin. If I can maybe add on to it, and I think that's where the value of the Rabies Center of Excellence recognition lies. It empowers a welfare group to go and engage with the state vet to say, I'm well aware that there are many welfare groups, some of them more fly by night than others, but our group has gone through certain checks and balances that means that we are potentially a valuable partner to partner with as opposed to another group. And that's the aim of this recognition, is to say there's value to this organization because they've done certain things to upskill themselves in the work that they do, which also means that there's a level of trust that can be placed in the work that they do. And 100%, Kevin, that's the end goal. Is we don't want to see welfare groups working against the government. In fact, I think the most important role is these groups supplement these efforts. A dog vaccinated by a welfare group doesn't seroconvert or isn't protected any more or any less than if it's a state vet. The objective is, and Kevin, you've said this for how many years, the objective is to get as much vaccine into as many dogs. That's it. And this is a way to supplement those efforts in recognition of the fact that the welfare groups are there for a reason. And we need to play to their strengths as opposed to opposing them. Thanks.
Thank you so much. Still on the similar topic, we've got a question from Claudia, who's asking, we don't have bad quality rabies vaccines in South Africa, do we? So I guess, Kevin, you might, and then Dr. Andre, you might be able to give us a bit more information about the quality of our vaccines here.
Yeah, we have a certain criteria for admitting a vaccine into South Africa legally. We can't say about anything illegal, and I've rarely seen anything illegal in terms. I think it's not a high value item that people would like to duplicate. So the quality checks that we do have are good. The vaccines that we have in the country are excellent. We have used most of them over the years, and it's about the quality of getting that vaccine into the correct dogs. And also remember that you don't have to always vaccinate everything. If there's certain communities that can sustain the disease, certain communities that can't. So we have to, again, work with the state vet to understand the disease in your area, so that you are vaccinating the correct dogs, that you're not working with them. But our vaccines that we have are really excellent.
Great. Thank you so much, Kevin. As we conclude today's session, we truly believe that together we can build a rabies-free future for South Africa. So to learn more and to register your interest, everyone who has been listening, please visit the link provided in the Q&A section. You will also receive an email from us with all the information. And thank you very, very much to our speakers. This has been invaluable information, invaluable contributions has been made, and a huge thank you to all of you, our dedicated attendees, for your commitment to animal welfare and public health, and for just taking out this time this morning to be here with us and to participate. We really look forward to partnering with you on this crucial journey, and we wish everyone a wonderful rest of your day. Thank you.